Guys, in this video I'll be sharing with you what is peptic ulcer, the causes of peptic ulcer, what is antacid, and the side effect of antacid on peptic ulcer. So what is peptic ulcer? These are sores that develop in the lining of the stomach, the lower esophagus, and also the first part of the small intestine known as duodenum. Peptic ulcer is the result of increase in secretion of gastric acid, and about 4% of the population have this peptic ulcer, and its prevalence varies with age, ethnicity, and socioeconomic status. Causes of this peptic ulcer, they include 1. Helicobacter pylori infection. The Helicobacter pylori infection is caused by a bacteria known as the Helicobacter pylori. This bacteria infects over half of the population worldwide, and about 80% of individuals with this infection are asymptomatic, while in others it causes an increase in gastric acid secretion, which irritates the digestive tract and also produces this sore known as peptic ulcer. How do you get this infection? You get this infection through kissing, ingestion of infected food and water. The second cause of this peptic ulcer is the long-term use of painkillers such as the ibuprofen, aspirin, and naproxen. Normally, these are painkillers. They are medication used to relieve pain, which include joint pain, rheumatoid arthritis pain, and even muscle pain. But the long-term use of this medication can cause peptic ulcer. What are antacid? Antacid are oral suspension. Normally, they are bases. They react with this acid to produce salt and water through a reaction known as neutralization reaction. Normally, the gastric acid is not harmful. Yes, they help to digest food, and they also help for absorption of certain nutrients such as the calcium, iron, vitamin B6, vitamin B12, and the folic acid. They also kill pathogens such as the bacteria, fungi, and parasites we ingest on a daily basis through food and water. But in the presence of this ulcer, the gastric acid irritates these wounds, and taking this antacid suppresses this gastric acid that is being produced. But the consistent and continuous use of this antacid reduces the amount of gastric acid that's supposed to be in the stomach, and this will pose many side effects such as 1. Chronic indigestion. Secondly, deficiency in many nutrients like the calcium, iron, and the folic acid, vitamin B6, vitamin B12, which will lead to diseases such as osteoporosis, hypertension, and depression. Another side effect of the long-term use of this antacid is that it increases the severity of this ulcer, because the antacid targets the acid that is being secreted, not the cause of the acid secretion, thereby allowing the bacteria to thrive. Another side effect is that it also makes the body prone to other infection that normally the gastric acid would kill. So because of this, the low level of the gastric acid, the body becomes prone to more and more infection. So how do you counter these side effects? There are ways you avoid the side effects of this antacid, and they are as follows. 1. Do not take antacid if it's not recommended for you by a healthcare practitioner. Secondly, if you have any pain, please talk to your doctor. Go to the clinic, go to the hospital. They know better. They know the medication to recommend to you at the right time, in the right doses. So please visit the hospital if you feel any pain, and don't go for over-the-counter painkillers such as aspirin and ibuprofen, because some people will even go as far as buying medication from the drugstore, combining both ibuprofen and aspirin together because of the level of their pain, therefore posing more danger and even encouraging more peptic ulcer to develop. Also, if you have peptic ulcer, please avoid food that will increase the secretion of this gastric acid, which is fatty foods. fatty food, salty food, they are included. Increase the secretion of this gastric acid and also irritates the wounds. Yes, salty food irritates the wounds. Avoid smoking because smoking delays ulcer healing if you have ulcer.